In San Diego in 2025, I think a lot of our Medicare clients are starting to find out where are those limits, where are the boundaries of a typical HMO Medicare Advantage plan, especially when it comes to doctors and networks or hospital networks, which have all but pulled out of HMO plans to some degree. So today we're going to dive into one of the few Medicare health plans that are PPO plans in San Diego, which is the Aetna Medicare Core PPO plan, and talk about the costs, the benefits, and the pros and the cons. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is that best Medicare option for them this AEP or really all year round, give us a call at the information down below, and we can help them to make those tough Medicare choices. Also, don't forget to like and subscribe. So why are PPOs so rare in Medicare? Why do they seem to have higher costs? And why would anyone want to select a PPO? Well, I think the big answer to this is choice and unpredictability. Unlike the typical Medicare Advantage plan that is an HMO plan, which requires someone to be assigned to a doctor and a beneficiary can only go see specialists that are referred to by that primary care assigned doctor, then there are also prior authorizations, denials, and the like. Well, PPOs, they don't have any of those and tend to give beneficiaries a much freer hand to go to any doctor who will accept payment, but that unpredictability is expensive to the insurance company and that cost gets passed on to the beneficiary. So you get more choice, yes, but you have to pay for it in the long run and sort of in the short run, but it should give somebody more access to more doctors, more networks than they would just have under the standard HMO plan. So let's get started with the maximum out-of-pocket cost, which is the limit that an enrolled beneficiary could pay for their medical services throughout the year. And I think that it is a good place to start with the Aetna Medicare Core PPO plan because it really illustrates how the PPO plan can act as an HMO or a PPO plan and how the costs differ when someone utilizes one or the other. On the maximum out-of-pocket, we can see that it has a maximum cost of $4,500 for in-network services and $8,900 per year for annual out-of-network services. Basically, a 100% more increase. The reason for this is because PPO plans have both in-network and out-of-network doctors. So in-networks are doctors who can be seen by enrollees and then start to act more like an HMO. But if someone utilizes services by a non-contracted or an out-of-network doctor, that still can be covered, but the maximum amount of money a person is going to pay for that is going to go up to that $8,900. So depending on how somebody uses the plan, those costs will change and could be lower or could be higher. Next up, let's talk about doctors and deductibles. Now, a deductible is the initial amount of money that a beneficiary has to pay prior to the plan starting to help out with their costs. In this case, there are no deductibles on the Aetna PPO plan, and that goes for regardless if the services are used in-network or out-of-network. But for actual doctor's visits, there's going to be a copay that will differ depending on whether or not the doctor is in-network or out-of-network. First up, for in-network doctors, there is a $0 copay for primary care doctors, and that would be things like a general practitioner, while a specialist who are in-network, there is going to be a copay of $30, which is sort of relatively high for specialist visits in comparison to the other standard HMO-only plans. On the out-of-network side, the raison d'etre for PPO has a primary care copay of $25 for the primary care and $65 for specialist doctors, which again are going to be quite high, but you have a much larger group of doctors of which one can choose from. Another big advantage of the Aetna PPO plan is going to be for lab work and diagnostic. Now, I know many of our clients either have a medical lab or a diagnostic center that they prefer to go to because either they are close to home or more often than not, it's because they have more time slots that are open for their services. But with an HMO plan, often somebody would be stuck waiting in line without that option to choose which one they want to go to. They have to go to the center that they've been designated to. But with a PPO, they could choose somewhere else with a shorter wait time, but again, with an additional cost. Here on the Aetna PPO plan, we can see that for lab work services that are in-network, there is not a copay or cost for those services, which I mean, is pretty good, obviously. But out-of-network labs, there will be a 65% copay, which is pretty steep. And additional for things like diagnostic services like radiology, MRI, EKG, etc. The in-network copay on that, $295. A lot, but still reasonable for what they are. While out-of-network costs are going to be 50% coinsurance, which can end up being considerably more expensive if the cost of MRI in total is $1,000. That means the minimum out-of-network someone could pay is $500 for it. And those costs get much, much higher. But you will still have the option to choose one or the other. So that's nice too. Another nice benefit that comes along with the Aetna PPO plan is going to be the PPO dental services. So yes, you have the PPO option for the medical services, but also on this plan, you have the PPO option for out-of-network dentists that can be utilized. Now for doctors, I think there is a reasonable argument why somebody may or may not want the additional out-of-network option with the PPO. But for dentists, I would say the PPO is the best way to go, primarily because dentists will generally prefer a PPO payment rather than an HMO payment, and many more dentists take the PPO than the HMO. And in fact, if you have a dentist that you know and you love and they treat you really good, they probably only take a PPO versus the HMO. That being said, the Aetna PPO plan has a $1,000 annual allowance that can be used for either in-network or out-of-network dental services. But again, the cost for those out-of-network services, even with a dentist, will be higher. And you can see for dental services, there's a $0 copay for in-network, and for out-of-network, 50% coinsurance. But again, good dentists, will be pretty hard to buy. Last up today for the Aetna PPO plan is a benefit that I think a lot of people don't think about really up until it's too late. And especially in comparison to the cost of just having original Medicare for these benefits, or even just having a standard Medicare Advantage plan, the Aetna PPO plan specifically is a really big benefit for the skilled nursing facility. Now, what is a skilled nursing facility? If we look at the Medicare and You booklet, ye old Medicare and You booklet, they basically define it as a place that is meant for rehabilitation after a surgery or an injury. It is not meant to be a permanent assisted living arrangement. Under Medicare, it is subject to the Medicare Part A cost. That is the $1,672 deductible for the first 60 days, and then daily costs after that. But on the Aetna PPO plan, they have it at a $10 per day for the first 20 days, then $203 per day after that up to day 100, which is a significant savings over just original Medicare. Of course, that is going to be for in-network skilled nursing facilities, but out-of-network using the PPO function will have a cost at 50% coinsurance, which is, I mean, it is going to be a lot, but will increase the number of facilities available astronomically, but just it's going to come at an increased cost. All right, so that is it for the Aetna PPO plan available here in San Diego County in 2025. And realistically, you can see what is the real difference in cost when somebody is using the in-network benefits like an HMO versus using a PPO benefit, which are more expensive as far as selection, but also as far as price. Really what it comes down to, as basically everything in Medicare does, is one's budgets, one's doctors, and one's prescriptions, and finding a plan that covers all of those, I mean, which can often be pretty daunting. So if you or somebody you know is trying to wade through all this Medicare milieu, please feel free to reach out to us at the information down below, and me or one of my team will be happy to assist them over the phone or in person at one of our many offices across Southern California in English or Espanol. So for Michael's Medicare, of course, I am Michael, hoping that you have a great rest of your day, and goodbye.